Be MedicineWise Week, Medicine Dependency and Misuse.
This Be MedicineWise Week, we really want you to know your medicines, to know how to use them so that you're safe and get the best effects from your medicines.
Medicine misuse is when medicine's taken in a way in which it's not intended. So it could be at the wrong dose, at the wrong time, and by the wrong person.
I took my kids on a horse riding adventure back in 2010 in the Snowy Mountains, and it was a 5-day wilderness safari, and it just went a little bit wrong.
My husband and I were out on our bikes cycling on a Sunday afternoon, and I was hit by a car.
I had a work-related injury. A lot of the nerves had been severed from the bone fragments from my disc, and that's basically where this roller coaster ride started.
And we were talking about what to do from now on and where we go from here. And he basically said, well, you're fixed. This is it. It's as good as it gets. Go off and live your life. And I said, but I'm still in pain.
I started to use the medication post-surgery, and at that particular point in time, it's quite an appropriate thing to do. But I think when they explained to me the possible side effects of the drugs, it was never in the context of I'm going to be on these for 3 or 4 or 5 years. It was on the basis that I'd use them while I was in hospital and while I was recovering over a couple of weeks maybe.
For nearly 3 years, I was taking a number of medications, at least 2 at any particular time. Yeah, taking them like sweets, really.
My pain is a sharp stabbing pains, 24 hours a day. Any kind of over-the-counter drugs or painkillers I could get, I would take.
These things are not fixing my problem, they're simply putting a band-aid over it. They're masking the problem, they're not fixing it. So when you start needing more and more and more of the same drug to get the same sense of comfort, that can't be the solution.
Medicine misuse can happen to anyone. It might be taking an extra tablet, missing a dose, sharing your friend's medicines, or maybe it's interactions between medicines that you're taking. So we really encourage you to know your medicines and talk to your doctor and pharmacist about them.
Over the years, I've seen several people dependent on medicines. And one thing to remember is that these people can come from all backgrounds, all professions, both genders, different ages. There's no one sort of person who is more likely to be dependent. GPs can help prevent misuse of medicines by ensuring that they have an up-to-date list of every medicine that a particular person is taking, by checking the medicines and removing any that they're no longer on, and then ensuring that when they do prescribe something new, that it doesn't interact with medicines that the person's already taking.
You think that you can manage it on your own, but you can't. You just need to talk to people and find it in your heart to open up.
I still have chronic pain, and it impacts a lot of things I do, but the difference for me now is I have techniques on how to manage that.
And that there is light at the end of the tunnel, albeit it may involve being in pain, but it's how you manage it and how you deal with it.
At MPS MedicineWise, we want consumers and health professionals to make the best decisions about medicines. That means having good information themselves and also talking with each other and having good conversations about how to use medicines.
Be MedicineWise Week. Visit nps.org.au/BeMedicineWise to learn more. Special thanks to Pain Australia. Find better ways to manage your pain at painaustralia.com.au.